We are winning this fight by breaking that stigma and breaking down barriers to seek resources. You are not alone.
Suicide among military veterans is 1.5 times higher than the national average. Now, a new campaign called Face the Fight aims to reduce that rate by half by the year 2030. It's ambitious yet, but our next guest here says it's achievable. That's Katie Donville. She's a clinical psychologist at the University of Texas Health Science Center in San Antonio. Good morning to you.
Good morning. Thanks for having me.
Glad to have you here. You know, you've spent your career researching PTSD and veteran suicide, and will be a beneficiary of the Face the Fight campaign here. Those suicide numbers, they are staggering. And why is the issue so difficult to tackle?
You know, I think that it's really important to understand that suicide is complex. There is not one when we ask the question why, there's not one answer, that there's a multitude of risk factors and protective factors that impact individuals differently. And so we're really excited to be joining with USAA and bringing alongside additional resources along with the nonprofit sector to join with the VA and the DoD in this really important fight to reduce veteran suicide.
You know, you say veteran suicide is not inevitable. It's all about a healthy transition.
Yeah, so one of the things that we know is that there are a lot of factors that may increase somebody's risk for suicide. We know that the transition between military service and veteran life can be stressful for a multitude of reasons. And so some of the factors that increase risk for suicide can be things like financial distress, relationship problems, employment problems, along with mental health problems. But we do know that more than half of those who die by suicide don't have a mental health disorder. And so that's one of the myths that's out there around that suicide is exclusively a mental health problem. But many people struggle with suicide at times. But we know that suicidal crisis is temporary, and there are resources that are evidence informed that can help people through that time.
You know, how did the UT Health team help build out the strategy for the Face the Fight campaign?
Yeah, so we have had the pleasure of working with USAA for the last year and a half. And part of that has been bringing together a team of experts and external advisory committee, including ourselves, experts from the DoD, the VA, from RAND, and other universities, along with nonprofit veteran service organization stakeholders. And together for the last 18 months, we've really looked at the landscape of the different strategies from the VA, the DoD, the White House, and more, and all the programs that are happening, and really identified that there's this opportunity for philanthropy and Face the Fight to focus on scaling evidence-informed interventions for suicide prevention in community settings, so outside of the VA and DoD.
And I guess what types of programs will it fund in San Antonio?
So this is a national effort, and we're really excited about that. And prior to our launch in June, we have been working with the Cohen Veteran Network, and in Dallas, the Stephen A. Cohen Family Clinic at MetroCare is available, Stop Soldier Suicide, the Headstrong Project. These are all organizations, in addition to the VA, that provide no-cost access to evidence-based resources for suicide prevention for veterans, service members, and their families.
Well, Katie, thank you so much for your insight and all of your work that you're doing.
Thank you.
To learn more about Face the Fight, to find help, or to join the fight, please visit wefacethefight.org.